What if I told you that meth, a word that conjures images of illicit drugs and hard-hitting crime dramas, is also a substance that doctors can prescribe? Yes, you heard that right. Stick around as we uncover the realities of Desoxyn, the prescription form of methamphetamine. Hi everyone, welcome to Psychiatry Simplified. I'm Dr. Sanil Rege, consultant psychiatrist. If you're into all things neuroscience and psychiatry related, then this is the channel for you. Don't forget to hit the subscribe button to stay in touch with all our future releases. Today's video is going to be about a topic that is both fascinating and somewhat controversial: prescribed meth. Before I start off, I want to say a big thank you to our viewers, those who commented on our previous discussions about methamphetamine. As you know, I've covered this drug in quite a few videos, as you can see here and here. So don't forget to check out those two videos to get a basis about what methamphetamine does to our brain and what its main mechanism of action is. To those of you that specifically shared your experiences about the use of methamphetamine as a prescribed agent, a big thank you, because it's those stories that have paved the way for today's video. Now, while the term meth is often surrounded by intrigue, dramatic and negative images, this video promises to reshape some of your preconceived notions. The very mention of meth triggers alarms, suggesting danger.
I am the danger.
And addiction. But what if this narrative is just one side of the coin? Let's find out. So in today's video, we'll be looking at Desoxyn, known in the medical world as methamphetamine hydrochloride. Now, it's not a drug found in meth labs or in some of the movies that you've seen, but a real medication with FDA approval for specific conditions. And this begs the question, why is such a powerful and dangerous stimulant part of modern medicine? This video will challenge our thinking. It will highlight to us that a drug by itself isn't necessarily all bad. It's how we use it where the real danger lurks. So in this video, we're going to delve deep into the heart of this paradox. Now make sure that you watch till the end of this video, because I'm going to reveal something astonishing about methamphetamine that I'm pretty sure you could never imagine. And I don't mean that lightly. So please make sure you watch till the end of the video. So firstly, let's look at Desoxyn, methamphetamine hydrochloride, and its mechanism of action. Methamphetamine is a powerful stimulant that releases dopamine, noradrenaline, and serotonin. And it does this at really high levels. Now, I've covered this in more detail in this video here, so don't forget to check this video out to go deeper into the mechanisms of action. But methamphetamine, by increasing levels of dopamine, noradrenaline, and serotonin, can improve key brain functions, which include cognition, activity, but at the same time can also suppress appetite and can increase metabolic rate, thus resulting in weight loss. And it's for these reasons that Desoxyn is FDA approved for the treatment of ADHD and obesity. Yes, you heard me right. Methamphetamine is FDA approved for the treatment of ADHD and obesity. However, the efficacy of methamphetamine comes with risks. The potential for abuse, severe side effects, and other drug interactions. You see, methamphetamine as Desoxyn would be prescribed in the most severe treatment unresponsive cases of ADHD. Its use is heavily monitored and regulated. So it's really not something that's going to be considered lightly when it comes to prescribing this agent. In fact, in Australia, it's not available at all. It's available in the US and is FDA approved for the two indications that I mentioned. Now let's compare Desoxyn as methamphetamine versus Adderall and lisdexamfetamine, which is Vyvanse. The simplest way to think about the differences between the three is that Desoxyn is the most powerful of them all. And what I mean by this is that its dopamine and noradrenaline release, and in some cases the serotonergic release, is the most powerful compared to the other two. And this is what makes it such a potent agent. Adderall, for example, consists of mixed amphetamine salts. Vyvanse, which is lisdexamfetamine, is a prodrug of amphetamine. It is hydrolyzed in the blood, broken down to release the active form, which then provides its benefits. Adderall comes in both immediate release and long acting. So when it comes to the duration of action, both Adderall immediate release and Desoxyn would act around 4 to 6 hours, whilst lisdexamfetamine is the longer acting version that would be estimated to last for up to 13 hours. Now, of course, there's a huge variation depending on different individuals due to a range of reasons. If you're a clinician looking to master ADHD in clinical practice, then check out our Academy course, the Clinical Excellence in ADHD Curriculum, a 13.5-hour journey with structured interactive learning, quizzes, case studies, video lectures, and literature, all synthesized in a comprehensive package so that you can make the most of your learning and apply it to clinical practice. So let's jump back to the video. So let's look at the dosing of Desoxyn in ADHD. Now, once again, this is an agent that is prescribed under medical supervision and is very, very closely monitored. So it's not something where one would receive the prescription for methamphetamine very, very lightly, because there are several other options with good efficacy. The recommended Desoxyn dose in ADHD is 5 to 30 milligrams, and this is prescribed in divided doses through the day. For obesity in adults, the recommended dose is 5 to 15 milligrams taken orally 2 to 3 times daily, and the 5 milligram dose is taken just before the meal. The specific dose and duration of treatment will of course differ from individual to individual. The treatment of obesity using Desoxyn is meant to be only a time-limited treatment, so it's not a longer acting treatment compared to the treatment in ADHD. Now, I know you're going to be pretty shocked by what I'm going to say next, but Desoxyn is also indicated for the treatment of ADHD in children, but not children below the age of 6 years. So for children greater than 6 years, the dose range is 5 to 25 milligrams. And again, when it comes to obesity, it is not recommended for children below the age of 12 years. However, for children above the age of 12 years, one 5 milligram tablet half an hour before each meal is the treatment recommendation. The recommendation, however, states that treatment should not exceed more than few weeks in duration. So it's meant to be a very short-term treatment. So you're probably asking me, Sanil, if Desoxyn or methamphetamine hydrochloride is FDA approved for the treatment of ADHD and obesity, why isn't it commonly prescribed? Well, the answer is the risk profile. Desoxyn is classified as a Schedule II stimulant, high potential for abuse. This is the classification by the DEA.
I don't know, man. You've been seeming sus lately.
Now, the other stimulants also fall into this category, the opioids as well, such as fentanyl. Schedule II essentially means that there is a high potential for abuse and therefore extreme caution is required when prescribing these agents. So let's look at the dark side of Desoxyn: addiction and dependency. Now at this point, you may want to go deeper into how methamphetamine affects the brain, so don't forget to check this video out if you want to dive deeper into meth's effects on the brain. When it comes to side effects, addiction and dependence, cardiovascular issues such as heart attacks, circulation problems, arrhythmias, fast heartbeats, increased risk of strokes, all are real side effects that can occur with Desoxyn. Exacerbation of mental health conditions or new onset mental health conditions such as anxiety, paranoia, hallucinations as part of psychosis can also occur. Furthermore, changes in brain structure or function, particularly affecting the movement areas of the brain, can occur with excess use or with misuse. It can affect the body in the form of tooth decay, dry mouth, or skin sores and infections. There are instances of sudden death as well. The key with methamphetamine is that the risk threshold is very, very low. So it doesn't take much for the individual to move into a risk profile that makes the drug dangerous. And that's the reason why there is extreme caution around the prescribing of Desoxyn. So you may ask, with such a high risk profile, what's the point of using it at all? The answer lies in its unique pharmacological property, which is the extreme high level release of dopamine and noradrenaline. For those where other medications aren't making a difference, Desoxyn could make a significant difference. The difference between leading a life with severe dysfunction versus getting back to some sense of normality. We know that Desoxyn's role in the treatment of ADHD is controversial. However, for some individuals, it can make a huge difference. As a practitioner, as a clinician, the aim is to weigh up the risks and benefits to make an individualized decision for the patient. Now, for the surprise that I mentioned at the beginning of the video. Methamphetamine has an astonishing and lesser known ability. It can transiently open up the blood-brain barrier, which is our brain's protective shield. Now, this unique property of methamphetamine is one of the reasons that leads to the neurotoxicity and the neurodegeneration that I covered in the other video here. However, it's the same property that provides some significant hope in medical science, particularly in treating aggressive cancers such as chronic myeloid leukemia and glioblastoma. That's right, methamphetamine could be an agent that could help in cancer treatment. So let's take the example of CML, chronic myeloid leukemia. So one of the treatments, imatinib, struggles to get across the blood-brain barrier, giving CML a refuge for unchecked growth. This is the same challenge that's echoed in glioblastoma treatment. The twist here is that methamphetamine has the potential to facilitate the entry of chemotherapeutic agents like imatinib into the brain to treat these elusive cancer cells. Thus, methamphetamine could offer some serious hope by significantly boosting the effectiveness of chemotherapeutic agents in the treatment of glioblastoma and CML. Moreover, selegiline, which is a MAO-B inhibitor used in the treatment of Parkinson's disease, but also has antidepressant properties. Now, this drug breaks down into methamphetamine. Thus, instead of using methamphetamine, there are studies suggesting the potential of selegiline, which breaks down into methamphetamine, as a method to open up the blood-brain barrier. Similarly, combining methamphetamine with dasatinib, which is a tyrosine kinase inhibitor that usually again cannot cross the blood-brain barrier, methamphetamine may facilitate dasatinib's entry into the brain to fight chronic myeloid leukemia. This highlights the potential role of methamphetamine in advanced medical treatments, challenging us to look beyond the stigma that's normally associated with the drug. As I said at the start of the video, it's not really the drug or the molecule that's bad in itself. It's often how it's used, the dose that it's used at, or the frequency of use that makes the drug harmful. It's a powerful reminder of why research and re-evaluation are vital in the ever-evolving field of medicine. So to summarize, we've seen both sides of the coin when it comes to methamphetamine. Methamphetamine can be a dangerously addictive drug, causing a lot of harm to individuals and communities. However, on the other hand, methamphetamine as Desoxyn, which is the prescribed methamphetamine hydrochloride, is FDA approved in the treatment of ADHD and obesity. However, it's only indicated in the most treatment-resistant cases, because for some individuals, that could make a huge difference. Further, understanding the psychopharmacology of methamphetamine tells us that its use can go beyond just the treatment of ADHD and obesity. Methamphetamine opens up the blood-brain barrier to facilitate the passage of chemotherapeutic agents and therefore may offer hope for individuals with CML and glioblastoma. So I hope that you found this video interesting and fascinating. If you liked the video, don't forget to leave us a like. Let us know in the comment section what you found interesting or your thoughts on Desoxyn. Thank you all for supporting this channel. I really appreciate it. And I look forward to seeing you in another video soon. Until then, stay fascinated. Bye-bye.